Hello and welcome back. You're still watching Good Morning KSA if you just tuned in. As we said earlier, today we're looking at plastic surgery, and we're going to be hopefully covering all aspects of plastic surgery. And we have a very special guest joining us here in the studio. I would like to say Assalamu alaikum, good morning to Dr. Muhammad Abdullah Al-Nassir, who is of course a plastic reconstructive surgeon who of course is at the Saudi British Hospital. Good morning to you. Good morning. How are you today? Great. Great. Thank you so much for joining us today, sir.
You're welcome.
Great. So today, sir, we're looking at plastic surgery. And as we were talking earlier, many people do not fully understand what plastic surgery is. So to begin with, to give me, Sahar, and of course the viewers an idea, what is exactly is meant by plastic surgery?
First, I would like to thank you for this interesting question. Because there is a lot of people, they don't understand what the meaning of plastic surgery.
Okay.
So plastic surgery is actually a very ancient field of surgery that dates back to 5,000 years before Jesus, peace upon him. Yeah.
Whoa.
That was started by early Egyptians in Egypt.
Wow.
Yeah, where they used to treat burns with mud and special herbs to ease the pain, to ease the pain after burns. It was started also by Indians thousands of years ago for nasal reconstruction after burns or after accidents by using microscopic tissue transfer from the forehead, for example. It includes many different subspecialties. Like you have like the craniofacial reconstructive surgery, you have microscopic tissue transfer, you have hand surgery by itself, it's a field, it's a subspecialty by itself. You have burn treatment and burn reconstruction and burn ICU treatment. You have treatment of skin cancers, different skin cancers by surgery. And
beautiful.
You have the congenital malformation, the pediatric congenital malformation treatment.
Amazing.
You have the aesthetic treatment, or the aesthetic subspecialty that you mentioned earlier. Like aesthetics, actually cosmetic.
Oh, cosmetic.
But I would like to correct the term later on. There's nothing called cosmetic. It's called aesthetic, actually.
But cosmetic surgery, the term, it's very
it's very popular.
Exactly.
You're right, but it's a misnomer, which is really reflect like how poor the English language is.
True.
Because no, it's really like English language has been like the first language or the international language because the U.S. has won the war after Second World War II. But like aesthetic is more genuine term because aesthetic surgery. Because like but you're right. Even in the Anglo-Saxon congresses, they use the term cosmetic. But when you go to the pharmacy, what thing do you look for if you want to buy a product or to beautify you? What kind of
cosmetic? Usually,
cosmetic. But there is nothing called like a surgeon for cosmetics. You understand me?
Okay. So something completely different.
Completely. So it's a misnomer. So the correct term is like aesthetic surgery.
Now here again, doctor, I'd like to say that as you know, people would just think that surgery, like for example, we know it's cosmetic surgery, so people wouldn't know what exactly it is. So we would want you to explain more in detail about the surgery, which is according to people, it's the cosmetic surgery. And I think, Diana, that is right, because cosmetic is something we apply on our face. So there is nothing like a cosmetic surgery.
Absolutely.
I would like just to continue with the definition you asked me for the plastic surgery. It includes also the humanitarian aspect of surgery. So the treatment of burns and post-war victims in Iraq, in Asia, in Africa, in Haiti, for example, the treatment of amputated patients. Me personally, being a member of different international society, like the French originated society, the Médecins Sans Frontières, or Doctors Without Borders, and the other society was Los Médicos del Mundo, or Doctors World, or World Doctors. We do a lot of missions that reflect the humanitarian aspect of surgery in general and plastic surgery in general. That you all, which is not only just the aesthetic field. It's aesthetics only like because it's like the field of plastic surgery that's well mediatized. That's the only thing. The last subspecialty is actually the new innovation in tissue engineering and the use of stem cell transplantation in the face and in the breast and different body parts.
Interesting. All right. And so, of course, I can see that you do have a very lovely patient here with us. For example, let's say, sir, if we are to perform plastic surgery on the face, for example, let's say, what are some points? Could you explain to us, for example, what would a doctor or what would a surgeon do to educate the patient? Because I really believe that the connection between a patient and a surgeon is very important.
Yeah, right.
But this is not something that we see in many places. So can you give us an idea about this, sir?
If you would allow me to go to the question
Yes,
of our
please,
friend, please, first.
Yeah. Well, I would
because you
just-
asked about aesthetic surgery, and it has many different procedures and many
Yes.
different operations. It includes the aesthetic or anti-aging medicine with fillers, using fillers, Botox treatment, which is actually the newest trend in the field of plastic surgery.
Okay.
And the trend now is for more injection and less surgery. That's the field for present and for the future. The second is fat grafting in the face, and the breast, and different body parts.
True.
You have the treatment, chemical peeling, the use of laser,
Chemical peeling, very common.
Body contouring surgery for abdominoplasty, body lift.
Yeah.
You have the treatment of post-cancer reconstruction with implants. You have the cancer the cancer patient. You have the aesthetic treatment for normal ladies,
for example,
for breast reduction, breast augmentation,
Mastectomy, exactly.
whether surgically or non-surgically. Now we can augment the breast and buttocks and non-surgically. Use
Non-surgical.
Non-surgically.
Okay, amazing.
Yeah, we can use like special products, which is and the fat. We can use fat as well to augment without using like surgery.
That's interesting.
We have the
So talking about Botox and fillers, it's very much clear that whenever a patient goes to get Botox or fillers done, so they are told that after a certain period of time you'll have to redo it, or the effect will be over. So does it actually harm your skin in any way? Like is it like kind of not good for your skin, or it doesn't affect at all?
Actually, you're quite right, because like the Botox, it's a chemical, and it's a
filler,
toxin.
isn't
Yeah,
it?
no, it's not a filler. The
It's not
filler
a
is
filler.
different. So they usually, the most widely used filler is called hyaluronic acid,
Hyaluronic acid. Okay.
which is now they are using the resorbable hyaluronic acid. In the past, they used the non-resorbable hyaluronic acid.
Okay.
If you're gonna touch on complication, that the complication usually starts from the non-resorbable
Oh.
hyaluronic acid.
okay.
The body cannot accept these kind of products. So the Botox has like a duration, like which is 4 to 6 months.
4
and
to
then,
6 months, right?
And then you have to reapply.
You have to reapply again.
No, but I mean, on the other hand, I mean, now you don't have to do like the old surgical procedure of the frontal lift.
Yeah.
Now, like you don't have to do like very invasive surgery. You can come in like between like lunch break.
Lunch break. This is very
like
common
in
period.
a 5 to 10 minutes like visit to your doctor, and you get treated.
That's all it takes.
Yes, and I have seen it in front of me. It was done actually live in front of us, where we were at one of the clinics, and they were offering a Botox there, and they just did it in like 10 minutes, and I was like really quick, and I was surprised that it is going to have a change on our face, and it's just done quickly. No, I did not had one,
I'm
but
wondering.
no, we were actually invited at this fashion show at one of the plastic surgeries clinics.
Okay,
so
all right.
there, they showed us how they do it and what are Botox and so
It's
and so.
amazing, but of course, as you say, Dr. Muhammad, it takes about 10 minutes, 15 minutes max.
Yeah, maximum.
And
you
the
can-
results are
I
evident
think
right there?
the
Yeah.
results, they take time to come over on the face, right?
to get the maximum results take time, but you
Yeah.
can see the result immediately.
Wow.
Going back to your question regarding this
Yes,
model,
please.
so the first thing is you have to know, like you have to observe, and you have to analyze, and to react, and then to act.
Of course.
This is like anything in the world.
Of course, yeah.
So if you observe very closely, you would see like in this like demo, you have like a lot of wrinkles like around
That's
the
where it happens, around the eye area.
and around the jaw,
Okay, around the jaw starts to
and
drop.
around the nasolabial fold around here,
Okay.
and in the frontal area.
These are very common in many people. Okay.
Because in the term aesthetic surgery, that we are dealing with 3-dimensional or 4-dimension. Like we have like the length, the width, and we have the depth. And we have the 4th dimension, which is based on the science of physics, which is the time. So we see the progression of these 3 dimensions over
and
the
you
time.
work together.
And
with
sometimes
that.
we do have lines nearby our eyebrows, in the middle of the eyebrows, right?
Those are the wrinkles, but the
Okay.
best thing is to understand and to analyze what type of wrinkles are they. So because you have a static wrinkles and you have a dynamic wrinkles. So the dynamic wrinkles, those wrinkles that's related to the muscle hyperactivity. Like if you have a hyperactivity of the frontalis muscle here, that's why you're saying that we inject the frontal area and the frontal muscle in specific points with a specific dosage of